Welcome back to Talk of the Town. I am joined now with Eric Hewitt, and you are one of the pharmacists over at the Medicine Shop Pharmacy, Monona. Thanks for being with us today.
Thanks for having me back.
And now we are talking about flu shots, and it may seem a bit early, but it turns out it's not too early, especially as fall starts. You kind of want to be preventative. Is that right?
That's very true, yes. And I'm sure there's commercials out on the radio too that talk about the fact that the flu shot can take up to 2 weeks to kind of take full effect.
Wow.
So it's not an immediate, coverage for that. And that combined with the fact that the flu season can start as early as mid to late September and go all the way through the spring months, the sooner you can get the vaccine, the better.
Sure. Now let's go over what is the influenza or the flu, because I think a lot of people think, oh, it's when you get a cold, but it's very different.
It is, and sometimes people even think that the flu is a stomach virus where you're having nausea and vomiting and things like that. Influenza is actually a virus, and it causes a lot, like probably the worst cold you've ever had, if you think of it that way. Aches and chills that come on very quickly, fever, stuffy nose, runny nose, congestion, those types of things. So like I said, think of it the worst cold that you ever had where you don't even want to get out of bed kind of a thing. That's influenza rather than the stomach issues that sometimes people associate with that stuff.
How long can the flu last?
It can last, it's a virus, so it can last, usually with influenza, you're looking at, a week or so, but sometimes in certain strains can last even longer, up to 2 weeks, 3 weeks, so it just really depends.
I had the influenza once, and it was the one time, I mentioned to you this to you before the show started, the one time I didn't get a flu shot, because I thought, I've never got the flu, I'm good. And I was probably sick for 2 weeks or more, because then the recovery time afterwards, and you're so weak, but
Run
man.
down.
Oh.
Yeah, I need you at the pharmacy to advocate all the patients that come in.
I'll stand there and tell everybody, please do it. It was awful.
Yeah.
I remember you just can't get out of bed. My whole body hurt. Oh, it was crazy.
And for certain populations, it goes a step further and it becomes dangerous.
Yikes.
Elderly and young people, infants and things like that, it can be deadly.
Wow.
So.
And I know you mentioned that people can start getting the flu as early as September, and it is September now.
Yes.
I mean, the summer just flew by, so really, it's not too far off.
Correct.
People could be getting sick soon, so it's important you get vaccinated prior to that period.
The sooner the better. That's what I always say. We have all of our vaccine in stock at the medicine shop, and as soon as we get that in, I'm telling our patients and asking them as they come in, would you like to get your flu shot today? Because the sooner you get vaccinated, the sooner you're covered.
Now, what are the different options for people who want to get vaccinated for the flu? Maybe they're a little scared of getting the actual vaccine with the needle. I know there's also a nose mist, but what works best?
Sure. It's all individual preference, really.
Sure.
So there is a nasal spray. The thing with the nasal spray is it is actual live virus, which means that if you have a weakened immune system or are taking steroids for a certain condition or in chemotherapy, you probably should avoid that type of vaccine. Then there's the shots, and there's also shots that are specifically for people aged 60 years of age and older. So it's a good conversation to have with the pharmacist as well to see which one would be best for you.
Individual basis.
Exactly.
Okay.
Yep.
And now, can we get the vaccine at the Medicine Shop Pharmacy and other pharmacies, and do patients need to make an appointment?
For us, absolutely, you can get the flu vaccine there. We've done it for the last, I think, going on 10 years now at the medicine shop. And we do ours by drop-in basis. You don't have to make an appointment. Most pharmacies these days, I think, provide flu vaccine, but not all. So I would definitely check with the pharmacist before just going in there and asking for it.
Now, can the vaccine make you sick? And I know sometimes you do feel a couple symptoms, but can it actually give you the flu?
Like I said, that's a myth that people have. Like I said, the shots are inactive virus. It cannot make you sick. You may have some pain or discomfort at the injection site, that kind of thing. We always like to say we try and be as gentle as possible, and hopefully our technique prevents that, but it really cannot make you sick, the vaccine, unless you have an allergy to some component of the vaccine, it's an allergic reaction. It's not actually the vaccine that causes you to get influenza.
Now, quick before we go here, is there a cost associated with the flu shot?
Most insurances these days will pay for the pharmacy to give them.
Nice.
If not, the insurance, if you do have insurance, a lot of times you pay up front, but you can get reimbursed from your insurance company. So again, another good conversation to have with the pharmacist.
I love that. So no excuses. Go get your flu shot. Again, Eric Hewitt with Medicine Shop Pharmacy Monona. Thanks for being with us today.
Thanks again for having me.
And thank you for watching Talk of the Town. You can find us next time only on Channel 57.